2009 was a year of innovation and dedication for the Salt Lake Valley Health Department, where staff were pushed to new heights. Events like novel influenza required that all of our staff dedicate themselves to dealing with a new public health issue.
New information today on H1N1 in Salt Lake County.
Today, in the fight against the H1N1 swine
flu.
The
latest wave of the H1N1 flu.
In the spring of 2009, we learned of the novel H1N1 influenza virus. At first, the reports coming out of Mexico were very alarming, and we began ramping up for a very severe illness. Fortunately, the virus was not nearly as virulent as the initial reports made it seem, but it was still a serious concern for public health across the country. The hours spent and the unceasing dedication of the Salt Lake Valley Health Department staff was incredible. It showed the strength and commitment of our employees as they rallied together, leaving their normal work assignments behind to focus on an issue that impacted the entire county. The response of public health to the H1N1 situation proved that public health has the ability, the perseverance, the determination, and dedication to what they do to be successful at helping the community remain healthy. 2009 was also a year of innovation for the Salt Lake Valley Health Department. In January of 2009, we launched a social media campaign that has been recognized nationally. One of the reasons I was most pleased about our creativity was that during a time when the economy has been tough, our staff rose to the occasion and remained creative and innovative. During 2009, we created 8 in-house videos to help promote our public health message. Creating these in-house videos not only helped us communicate better with the public, but helped set a standard for how government should be communicating with the public they serve. We've learned that using social media is a critical way for us to be able to interact and communicate with our residents.
We created a new website for Salt Lake County that posts all of the food inspection reports and a lot of additional information. What we were trying to do was be transparent. Immediately, we started getting hits, and within an hour, we had over 60,000 hits, which was more than the site could handle, and it crashed, which was a pretty good indication we were succeeding in getting word out. We hit a nerve with people wanting to get information about something that is important to their lives. One of the most important things that we have is the ranking system, where within each risk category, facilities are ranked 1, 2, 3, or 4 stars, depending on the outcome of their inspections. We're recognized as being one of the best websites, if not the best website out there right now. In September of 2009, we had a very unusual outbreak of what's known as ascariasis. But what we did was we responded with our emergency response unit. We went out to what was the commonly identified source of probable infestation, and that was Ochre Lake out of the Daybreak development on the west side of the valley. We depended on a good working relationship with the people at Daybreak to ensure that there was a good public health outcome for the people who use the facilities out there. Coming together, everybody here did the right thing. The outcome of this was very positive.